you so much for tuning in to KBTV. I'm Dr. Karlisha Booze. As technology continues to evolve, Piedmont Macon has taken advantage. They've started robotic surgery where they've completed 5,000 robotic surgeries. And today we're joined by surgeon Dr. Eftaiha, who's going to talk more about the robotic surgeries and how successful they have been. So thank you so much for joining us.
Thank you for having me.
Absolutely. So Dr. Eftaiha, can you talk to us about the robotic surgeries and, the benefits of being able to, have those surgeries?
Yeah, absolutely. Robotics is a relatively new technology that we've been using to enhance minimally invasive surgery. It's helped us be more successful in improving patient outcomes, including shorter lengths of stay at the hospital, improved pain from major operations. And also it helps us reduce infection rates as compared to traditional open surgery.
Okay. So let's talk about the recovery. I know you mentioned prior to the interview that the recovery rates are much quicker. Why is that?
I think it has to do with, again, the minimally invasive component of it. We make very small incisions on the body surface, and the robot allows us to have a lot of dexterity within the body and operate on organs without having to increase the size of the incision. And this helps in terms of recovery with pain. And so patients tend to take less pain medication because the incisions are smaller. The stress on the body is smaller. And with less pain medications, there's quicker return of function, which translates to decreased length of stay overall for our patients that we've noticed.
Okay. So the surgeries also give an advantage of having less risk infections. Talk about that for me.
That again also ties into the idea of the incisions being smaller and not as traditionally big. So with the less trauma to the skin and exposure, and then the less chances of infection at the skin site level.
Okay. Now, talk to me about how does this actually work? I know some people may feel a little skeptical about, getting robotic surgery. So how does it work? I mean, they're probably wondering, okay, what if there are malfunctioning? So talk to me about, if there are there any contingency plans that are, in place in case there are any malfunctions?
Absolutely, that's a great question. When we talk about robotic surgery, we're talking about instrumentation. So we're very much in control of the robot, and it's essentially just an instrument that we control. So we're doing the operation, and it's not by any means a self-sufficient and moving entity. And of course, anytime we detect any malfunctions with the instrumentation, just like any other instrumentation, we troubleshoot it and fix it, and we're able to replace it. But if there's any further problems, it's very easy to disengage these instruments again, which would be the robot, and be able to complete surgery in a safe way, in a safe manner, in the traditional method. So it is not a sort of artificial intelligence, self-driven modality. It's very much driven by us. We're in control as surgeons, and again, it's just an instrument that we use that helps us improve outcomes overall for patients.
Okay. Now, I know you talked about the benefits, just real quick, as opposed to the traditional way, just having someone in the operating room and, you're doing it yourself. Is this, I would say, saves time? Is it quicker doing the robotic surgery as opposed to the traditional way?
I think that the advantage is for the surgeon specifically, and also for the patient, is that it improves exposure without having to open up the body in a certain way. So we're able to see things in much greater detail. And that's where I think the true advantage is. And a lot of times it depends on the specialty, but urologists, colon rectal surgeons, general surgeons, gynecologists all use robotic technologies, specifically in areas that are known in the body to be very tight and with not much room. And it allows us to perform maneuvers in those tight spaces without making these very large incisions. And I think that's where the true advantage with robotics is.
Okay. Well, thank you so much, Dr. Eftaiha, for coming on the show and just, explaining in detail. And also, I just want to say congratulations for, those successful surgeries that you guys have done. And again, people, this is a really big deal, because Piedmont Macon is the first in Middle Georgia to, do the robotic surgery. So again, this is great news. So thank you so much, Dr. Eftaiha, and you have a great day.
Thank you so much. Thanks for having me.